All right, we're going to go ahead and get started today. Thanks for joining us for the HealthLinks webinar series. As many of you know, HealthLinks is a signature program for the Center for Health, Work, and Environment, and we are here at the Colorado School of Public Health. And HealthLinks collaborates with employers to build a culture of health and safety in the workplace. My name is Kaylee Rivera. I am the Community Engagement and Trainings Manager with HealthLinks, and I'm excited to bring this webinar series to you and have you all learn more about different ways you can implement health and safety in your workplace. So many of you are aware of the different housekeeping items that we have, but I'm going to go through them. First, I just wanted to touch on the HealthLinks benchmarks. This is what comprises our online assessment, and we have organizational support, workplace assessments, health programs and policies, safety programs and policies, engagement, and evaluation. And all of those are really sustainable components within your employee health and safety culture. And today's webinar pretty much overlaps all of these areas because we're going to be talking about positive workplace relationships, employee engagement, health equity, and inclusion. And I don't think there's a place you can really say that doesn't touch on within the HealthLinks standard. Just so everyone is aware, besides our two presenters, everybody else will be kept on mute throughout the duration of the presentation. But if you do have a question, you can use the chat box, and we will see that pop up, and we'll hopefully be able to field the questions, and we'll kind of decide if it's appropriate to do that right in the moment or if it's best to kind of wait and circle back to those questions at the end. And for everyone to know, this is being recorded and it gets posted on our HealthLinks YouTube page, but there will also be a follow-up email sent out to each of you with the link to both the slides and the video presentation. We'll also be sending a survey within that we'd love to have you take so that we can get some feedback on how you enjoyed this presentation and any other topics that may be of interest to you so that we can bring to you what you want to hear. All right, so these are our two presenters, Diana Resnikoff and Abigail Ho, and I wanted to take a few minutes to talk about who they are, where they come from, and their expertise. So Diana assists organizations with creating sustainable and innovative programs that support a culture of health, safety, and well-being in the workplace. For the past 13 years, she has worked in the health and wellness industry, promoting healthy lifestyles. She believes every person deserves access to health and well-being. One way she has put this belief into action is by establishing the Grow to Share program to increase access to healthy food choices for low-income community members in Summit County, Colorado. Diana serves as the Summit County Community Ambassador and as the chair of the Physical Activity and Nutrition Alliance of the Summit, nutrition team of the Summit. And her favorite worksite wellness activities are flex schedule and healthy food options in the workplace. And Diana is the lovely lady in the center here with the beautiful smile. Now we have Abigail, and she is the owner of Life Work Balance, LLC, and she believes that we work to live, not the other way around. I wonder if I have this on a timer. Very strange. Sorry about that. Abigail works with companies and organizations to increase the overall satisfaction, engagement, and effectiveness of their workplace, ranging from operational staff to executives. Abigail does this through consultation and coaching, speaking, training, and facilitating workshops. On a smaller scale, Abigail works with individuals who may be going through a career transition or are beginning to feel stagnant and bored at his or her position. Life Work Balance serves a wide range of clientele, including working professionals, students, academics, first responders, active duty military, veterans, and their families. Thank you for being here, ladies. I'll let you take it from here.
Great. Thank you, Kaylee, for that awesome introduction. So first, Abby and I would really like to just share our appreciation for everybody attending this webinar today, because creating engagement, health equity, and inclusion in the workplace is really hard. So we really commend you for coming on to this webinar to find out some strategies. So let's move on. What are we going to really focus on today? We're going to focus on the correlation of increasing employee engagement with equity well-being, and safety in the workplace. We're really going to focus on what is health equity and what that means, and then give you guys some strategies and case studies for health equity within the workplace.
And once Diana wraps up her aspect, I'm going to go ahead and take over and talk specifically about positive workplace relationships, which is one specific way that you as an individual can begin to promote employee engagement in the workplace.
Great. So why is employee engagement important? Let's get on the same page and understand the definition of engagement. So engagement is more than just participation. It aims to involve employees in healthy business culture and increase enthusiasm at work, especially with your leadership. So you want your employees to follow leadership because they believe in the mission, not just because they're getting paid to do it. According to Gallup, only 33% of the United States workforce is engaged in work. So engagement is a mechanism by which organizational support and culture can change and shift positively. So how do we do that? We do that by increasing equity, well-being, and safety within the workplace. So why is equity, well-being, and safety important in the workplace? First, we're going to focus on what is equity. I want you to shift over to the image for equality. So in the context of the workplace, equality means that you give your employees the exact same opportunity for, let's say, the management position opening. As you can see in this image for equality, all of those employees have the exact same height boxes to see over the fence into the game or for that management opening. Whereas if we shift to equity, not only are we offering our employees all the same opportunity for that management position, but we're also understanding the social determinants that allows access for them to potentially apply for that management position. As you can see in this image, the social determinant is that one of your employees is shorter than the rest. So in that case, the employer understands that and gives that employee that extra box to see over the fence into the game. Unconscious and systematic bias has become an obstacle to health equity in the workplace. So many of you guys may be familiar with this image. That's Serena Williams. She had a near-death experience in birth. After her C-section, she approached her nurse and said, "I know my body, I'm hemorrhaging." Now, hemorrhaging is a common side effect of C-sections, but unfortunately, her nurse did not believe her. Thankfully, she was able to get the care that she needed to appropriately get the care so that she had success, which is unfortunately not the case for many women within this country. So now let's look at the unconscious biases and social determinants that really affected Serena Williams' experience. A lot of people, the first thing that they think about with social determinants is income. With Serena Williams, she's a billionaire, so that definitely does not limit her access to care. But the social determinants that do affect her and the unconscious bias is that she's a woman and she's Black. Black women face one of the largest health disparities of all minorities. And Black women are disproportionately more likely to have pregnancy-related complications. According to ProPublica, they are 3 to 4 times more likely than white women to die from pregnancy-related complications like Erica Gardner. So a big part of breaking down this stigma is having and building those relationships with your employees. So let's zoom in now back to the workplace. Those who experience discrimination at the workplace were 2 times as likely to report illness, injury, and assault. Health Affairs did a really great report on work-related disabilities by age and race. I'm going to really focus on the columns, the orange columns. That's ages 50 to 64. As you can see here, minorities of this age have higher risk of injuries at the workplace. So again, let's focus on what were the social determinants that really affect why minorities have a higher risk. Well, predominantly white employees are in supervisor positions and are paid higher, whereas minority workers have lower salaries as well as they're working in more manual labor positions. So when I first saw this report, I kind of thought to myself, well, in my workplace, we're all young and we all kind of look like me. But then I did some research, and according to the CDC, by 2020, 1 in 4 employees will be over the age of 55. And the U.S. Bureau of Labor Statistics projects by 2032, the workforce is going to be majority people of color. So even for me, maybe currently this may not be something that I need to think about, but in my near future, our workforce will be aging and changing. Great. Loss of productivity from absentee cost employers $225.8 billion. 92% of working adults spend at least 45 hours at the work each week. That's more than eating, sleeping, and conversing with family and friends. And that's why the workplace is an ideal place to tackle health equity, well-being, and safety issues. So how do we tackle those issues? We're going to jump into some strategies on how to increase inclusion and health equity in the workplace. While I'm talking to you about these strategies, I want in the back of your head to have this quote. Regardless of background or job status, extending the reach to your employees positively conveys an organization value of health. So you may be squinting at this slide. That's on purpose. This shows all the different social determinants that affects the access to equity within the workplace. The Workbook Collaborative did a really fantastic report up here in the mountain communities, and they asked a diverse group of employees what were those social determinants that really affected that access to productivity at work. And surprise, surprise, healthcare was the #1 social determinant. Then there was transportation, housing, and childcare also ranked in the top 4. So it's really important to understand that you really have to understand the needs and interests of your employees to truly understand what their social determinants are. We don't need to tackle this whole web of all these different social determinants. You just need to ask your employees what affects them and how you can help them become more productive at work. Another great Gallup poll shows that thriving managers are 2 times more likely to be engaged if you have these 5 elements within your well-being, health, and safety programming, and that's social, purpose, financial, community, and physical. Great, so what are the steps to implementing equity within the workplace? I'm going to outline these and then go into more detail. So that's leadership, voice, inclusion, communication, evaluate, and peer support. So leadership, I heard once this great quote, leadership is not a noun, it's a verb. And I really believe in that because leadership is about action. Modeling the way will increase the buy-in with your employees. Committing to the change that you need to implement to increase equity, well-being, and safety in the workplace is so key. And then building relationships and trust with your employees will really create momentum to support equity in the workplace. Abby, I'm really excited about her section because she will go into detail about those relationships. And then finally, with leadership support, you need to have that awareness and equip your leaders as well as your managers with the correct tools to support equity, well-being, and safety at the workplace. A really great example of that is with summitcove.com. They are an organization up here in Summit County, but their C-suite is down in Denver. Annually, they pay their employees for a volunteer day. This was a town cleanup day. 50% of their employees are in housekeeping, and the feedback that they got from all of their employees was it was very powerful to bump elbows with leadership and also see leadership picking up trash. The next step is employee input and voice. It is so important to solicit feedback from your employees through needs assessment, surveys, or face-to-face conversations with them. Once you have that feedback, analyze it, and then, of course, be transparent and share that with your employees. And create programming around their needs and interests, approve upon those, and then finally measure the success or opportunities for growth. The town of Frisco has been certified with HealthLinks now for about 4 years. One of the biggest things that they really truly needed help with was engagement with their employees. So we suggested that they have a survey. Within that first year, they had about 27% participation in that employee needs and interest survey. This year, they had a 98% participation within that employee needs interest survey, due in part to HR driving all programming around the interest of their employees and their employees understanding that they were being heard and programming was created around their interests. So being inclusive is so key to increasing the equity within your workplace. So understanding how you're communicating with your employees, what is their literacy level, their cultural background, and their language level. What is their needs and interests? Understanding their cultural backgrounds, what days may be important for them to take off. And then finally, understanding that reach is so key to increasing that inclusion and engagement within your employees. So that's offering benefits to your part-time, full-time, seasonal, and contract workers. I'm not saying that you have to offer, let's say, healthcare to all of your employees, but there are low costs where you can really engage all of your employees with programming. Summit County government really embraced inclusion in the workplace. This is Leslie. She's part of the sheriff's office. She approached her supervisor with her letter of resignation. Within that letter, it said that she was coping with depression, due in part because she wanted to transition into a woman in a community that would support her. Once her supervisor understood her situation, he supported her through her transition to be a woman. So not only did that really benefit Leslie, but it also benefited the culture within Summit County government because their employees understand that leadership will meet them where they are. Also, unconsciously, it really helped with their recruiting aspect because this story went viral in the LGBTQ community. So communication, in any business, communication is so important. Being transparent with your employees with those major decisions is really important. Creating a communication plan with goals, objectives, target audience, strategy, a key messaging, and understanding the communication channels that work best for your employees is really important, as well as a budget. Leveraging events is really underutilized. So if you have an employee picnic or biometric screening, conveying the message of equity, well-being, health, and safety during those events could be very easy way to support engagement with your employees. Some of you guys may be familiar with the communication rule 3-7. So that basically means communicate 3 different ways: written, verbal, and visually 7 times. And when you're doing that, be frequent, positive, and concise. And then finally, have some fun with it. Create a brand around your well-being, health, and safety program. So the town of Breckenridge had a really comprehensive well-being, health, and safety program already in place, but they had really low engagement. So within the HealthLinks advising session, we suggested to elevate their program by branding it and taking it the next level by allowing the employees to have that ownership around that brand. So they had a competition for the brand, and one of the employees won for Mind Body Breck was their brand. Great. So I find with a lot of organizations that evaluation is missed quite often. So it's really important to make sure that policies are being adhered to. A really easy way of evaluating the success of your program is just through participation. So just doing a head count is an easy way, or at a lunch and learn, having a satisfaction survey after that lunch and learn, and gauging the attitude change once you implement programming. And then finally, utilizing that data to either pat yourself on the back or adapt and grow if there's obstacles. Ariel, Clinical Services had a really low-tech way of tracking their well-being health programming, and they just came into the 21st century and launched an online platform. Since then, they've had a lot of feedback from their employees saying that they have a lot more ownership to be able to track their own well-being goals, as well as it's really freed up a lot of time that the Wellness of Champions were using to input the data. And now they have this time to really do what they should be doing, and that's connecting with their people. Peer support. This is free and underutilized in a lot of organizations. So the first step to supporting peer support is encouraging your employees, especially those that may have chronic diseases and really need that extra support to be part of the inclusion well-being programming that you offer. A way of doing that is by having champions of wellness. At HealthLinks, we call them COWS. That's Champions of Wellness and Safety. So when you're finding those champions, understand that they should be at all levels of employment, and maybe have an understanding of the cultural background of your employees. And then finally, again, have fun. Create walking clubs or like the happiness challenge at your workplace. So the Family Integral Resource Center here in Summit County had Champions of Wellness, and one of their hot topics was stress management. One of their champions decided to create Zumba to mitigate that stress management, and she offered it not only in English, but Spanish as well. It became so popular that it grew out of their community space, and now they've moved to a much larger space. Now we're going to focus on some case studies looking through the equity lens. Some of you guys may be familiar with this logo. This is Google. Yes. So Google has been #1 for 8 years with the Fortune 500 best places, 100 places to work. They've been ranked that high, they've been ranked #1 for that long for one reason, and that's that they are inclusive with all of their employees. So they offer benefits to their full-time, part-time, and contract workers. Some of those benefits could be as simple as offering them a free haircut, or as big as having town hall meetings for their minority workers. Let's move on. Great. In the 21st century, technology has become a great asset to us and made telecommuting a lot easier for us. So CDOT Oversized and Overweight Permit Office has really benefited from telecommuting. Their turnaround times are 48% faster, and their calls handled are 5% higher. It's also benefited their team members by saving each of them about $2,000 annually due to commuting costs. So if you have the capacity at your workplace to telecommute, it's important to have some guidelines. So creating expectations regarding telecommuting is important. Measuring that performance and utilizing technology like Zoom within your policies. Okay, top talent. So inclusion, equity, and well-being safety really roots from leadership and the folks that you hire. So it's really important to understand that hiring managers, regardless, we're human beings, are going to have those unconscious biases, right? So it's really important to use those technical assistance to kind of create that top candidates before you even interview them. That way the technology, they don't see color, they don't see all the other social determinants. They just pick what could be the top talent candidates. And then when you're actually interviewing them, the hiring managers should really understand that they are regardless going to have that unconscious bias. For instance, I have a twin sister, her name's Alex. So everybody that's named Alex, I love automatically. So it's really important to not just anchor on one thing, but look at your interviewees holistically. So for example, Albert Einstein was a horrible speller, not only in English, but in his native language of German. So if a hiring manager just focused and anchored on the fact that he was a horrible speller, the manager would have lost top talent and denied a genius from joining the team. Awesome. So a great way of breaking down those barriers for those unconscious and systematic biases that really limit the access to equity within the workplace roots from positive workplace relationships. And I'm really excited for Abby to go ahead and take over this section.
Thank you, Diana. All right, so we presented a lot of information to you so far. So I just want to dive deeper into a specific topic, which is positive workplace relationships, so that you can focus on one way to improve employee engagement in the workplace without feeling too overwhelmed. I think most of us can agree that the idea that relationships in the workplace is important, but we don't really know why. It's a lot harder to explain. So I'll try to do that for you today. So before we begin, I just want you to think about someone that you've worked with, past or present, and think about your relationship with them. How did your relationship with that person influence how you felt about your workplace overall? Now, you may have had a person with a positive relationship pop into your mind, and maybe that person made you excited to go into work each day. And by being able to work with someone that you had a friendship with, that may have made you excited for Monday, excited to go into the workplace. However, if you maybe thought of someone that had more of a negative relationship with you, maybe they influence your feelings of the workplace to be a little bit more negative. So maybe Monday came along and you dreaded waking up, getting out of bed, and having to go talk with that person during the workday. Positive workplace relationships strengthen morale, retention, productivity, and teamwork. And those are some pretty hard hitters when it comes to business keywords. So if all it takes is increasing positive workplace relationships to increase morale, retention, productivity, and teamwork, then why is it so difficult? So let's talk about two of the primary relationships in the workplaces, or two of the primary types. We've got relationships with coworkers, and in a 2016 study by the Society of Human Resources Management, they found that 77% of the respondents agreed that the relationship with their coworkers was a top driver of employee engagement. And on the other hand, we have relationships with their immediate supervisors. These same respondents in the Society of Human Resources Management survey, 74% of them agreed that their relationship with their immediate supervisor was another top driver of employee engagement. Now, this makes sense because if you are working with your coworkers and you see them on a regular basis and you have a good relationship with them, you're likely to be more engaged as a worker. And it's the same thing with your supervisor. If you're engaging with your supervisor on a regular basis and they make you feel like you're incompetent or you're not good with your position, or they make you feel just bad in general when it comes to your overall feelings in the workplace, you're probably not going to be as engaged as a worker. The reason most companies fall short on the engagement front is because they lack a focus on human relationships. So if we think about employee engagement, it kind of is based off of the foundational feelings of contribution, trust, and altruism. And those feelings are all derived from one thing, which is human relationships. So if we forget to focus on human relationships and we move right into our employee engagement plan without that foundation, our employee engagement initiative and strategies are likely to fail. So this is kind of an overwhelming, I guess, chart or spectrum. This is the workplace relationship spectrum, and it has two axes: interaction, going, I guess, from left to right, and then high relatedness, which is kind of brown. And I first want to define what interaction and relatedness is. So interaction is how often people connect and communicate, where relatedness is how much two people have in common. So in the back left corner, we have high relatedness and low interaction, and there's not really many people there. And that makes sense because if you have low interaction with someone, the chances of being able to identify how much you have in common with someone is pretty low. So next we'll move to the larger quadrant that's at the front of our screen, which is low interaction and low relatedness. And we have some people who fall into that category. We have work acquaintances and personal acquaintances. And this also makes sense because if you have a low interaction with folks, you don't have a chance to connect or communicate with someone, you probably will also have low relatedness because you can't determine how much you have in common with them. So we'll move on to the right quadrant, which is high interaction and low relatedness. And in this quadrant falls some immediate coworkers and possibly your supervisor. So this might be someone that you interact with on a regular basis, but not necessarily to find out how much you have in common with them. So, you know, I might walk down the hallway and see the same person every single day on my way into work, but all I do is say hello to them. I don't engage in normal conversation, so I don't learn what we might have in common, and so we can't really build a stronger relationship. Finally, in the very back quadrant, we have high relatedness and high interaction. And this is where your family and friends might fall, coworkers with your shared interests. And again, this is kind of where we want to focus when it comes to building a relationship-centric workplace. If we have individuals that have a high interaction with us, so we connect and communicate with them on a regular basis, and we also find out that we have a lot in common with them, our relationship is likely to be more positive and stronger than it would be otherwise. So let's talk about NASA really quick. We all know this logo. A good example of a positive workplace relationship is in 1962, President Kennedy visited the National Space Station, or excuse me, not the National Space Station, that would have been incredible. He visited NASA, and he asked the custodian, "What do you do?" And the custodian famously responded, "I'm helping send a man to the moon." Now, this is pretty impactful because the custodian isn't actually helping send a man to the moon. He's not an engineer, he's not a mathematician, he's not working directly with putting a man on the moon. However, the relationships that he had with the people he worked with and his coworkers made him feel like he was a part of that mission and that he was actually contributing to that greater good. Now, if his coworkers had shunned him, considered him as only a janitor, you know, not really involved in conversation with him, his feelings of the workplace would have probably been a little bit different. So why is it important to have a relationship-centric workplace, and what does it look like? Going back to the spectrum, we really want to focus on the high interaction and high relatedness relationships. So the key to maximizing engagement levels is putting relationships at the center of your work environment. So we need to create a space where employees are free to build common connections around the things that they care about most. All workplace relationships are important, but when it comes to relationships between employees and high relatedness and high interaction, you don't want an environment where employees can just become good friends or close friends. You want an environment where they can become best friends. Now, this can kind of be a little bit controversial, but a relationship-centric workplace is one that focuses on the relationships between employees that are high in interaction and high relatedness. So if employers can recognize these opportunities for these positive and I guess high relatedness, high interaction relationships, then they can really increase engagement overall in the organization. So Gallup, which is a research-based global performance management consulting company, they've been conducting employee engagement research for over 30 years, and they usually ask this question in all of their employee engagement research surveys. And again, like I said earlier, it's kind of controversial because some individuals believe that having a best friend at work is actually more distracting and detrimental to getting your work done, whereas others believe that it has this positive influence. I fall more towards that latter, which is having a positive influence in the workplace. And Gallup has found the same. So they asked this question for two reasons. One is for performance, and Gallup's survey responses have repeatedly shown a concrete link between having a best friend at work and the amount of effort employees expend in their job. And for example, women who strongly agree they have a best friend at work are more than twice as likely to be engaged as compared to women who say otherwise. So that otherwise includes individuals who just agree they have a best friend in the workplace, who are neutral or don't agree. So there's a pretty strong suggestion that if you do have a best friend in the workplace and you strongly agree to that, that you will perform at a higher level than those around you. Second is a holistic reason, and we want to consider what's happening in the workforce. So we spend more of our waking hours at work than we do at home, so it's only natural that we want to build connections with our team members. Many employees expect more than just a paycheck when it comes to their job, and research shows that employees seek out and stay with organizations that have exceptional workplace cultures. Again, the basis of having an exceptional workplace culture is building it upon overall feelings of trust, belongingness, and inclusion, which come from those foundational feelings from human relationships. We want our work to feel worthwhile, and having trusted confidence in our workplace and having supporters in our workplace helps foster that feeling of our work being more than just a paycheck. If companies are able to increase the ratio of employees who have a best friend at work, they can experience a decrease in safety incidents, increase customer engagement, and increase profits. So right now, only 2 in 10 US employees strongly agree that they have a best friend at work. The number that would be important to increase this to would be 6 in 10. And this is important because when employees possess a deep sense of affiliation with their team members, they're driven to take positive actions that benefit their business. So these actions may not be otherwise considered if they don't have a strong relationship with their coworkers. It's more of every man for themselves. In addition, employees who have best friends at work are even more likely to assist each other in stressful situations, and they exhibit healthier levels of stress management. So now I want to go into some strategies that you can begin to use to develop a more relationship-centric workplace. Granted, these are just starting places, but this will help you create a foundation of positive workplace relationships so that you can begin to increase your overall employee engagement. So I'll talk about interaction, social tools and technology, culture, recognition, input, and diversity. So we want to invest in face-to-face interaction. Although digital technology has enabled us to chat from anywhere in the world, whether it's from email, Skype, on our phones, we can't put a price on face-to-face interaction. 93% of information we convey is through nonverbal expressions and tone of voice. So if you're doing everything through written communication, there's a lot of opportunity for miscommunication. So if possible, we want to consider rearranging our office space in thoughtful ways that would encourage more face-to-face interaction. And this might include providing company-wide events for facilitating discussion and bringing employees together. If you have remote employees, and I know telecommuting is becoming a more popular option for employers, but we would want to invest in video conferencing options, such as Zoom, like we're using now, so that you can not only talk to your employees, but also see them, so that you can tune into some of those nonverbal cues. We also want to improve our relationships with social tools and the right technology. And face-to-face interactions can be augmented by technology, such as Zoom, like I mentioned earlier. And this will help strengthen personal relationships and enable frequent, consistent interactions regardless of time or location. Social communications channels play a big part of how we build and maintain relationships in our professional lives, and organizations must embrace these roles by channeling or by augmenting face-to-face interactions. When we provide a digital space for our employees to frequently interact with one another, organizations can ensure that these employees are able to foster connections and build professional relationships regardless of their location or role. We also need to exemplify the culture we crave. So leadership and management needs to both walk the walk and talk the talk. And it's not enough to just say that you want positive culture. We have to live it. We have to establish consistent patterns of behavior that build a culture of positivity, inclusiveness, and belonging. And if you're genuine with your intentions and authentic in your practice, your employees will recognize your efforts and you'll be able to see that change in their interactions. And it's pretty typical for employees to start buying into employee engagement planning and programming once their leadership shows that they're truly dedicated to the programming. We also need to remember to offer recognition frequently. We need to prioritize micro recognition, so small but frequent acknowledgments of success that come both from peers and management, instead of just a top-down macro recognition approach. So, you might get a mass email from the director of your department recognizing one person, and that might happen just a couple times a year. We need to focus more on those micro recognitions of saying thank you to someone in the hallway, maybe writing a quick thank you note. We also need to be aware of who our employees are and what they're comfortable with. So for example, if you have an employee who's an introvert, it might be their worst nightmare to be recognized at the company-wide holiday event. If you bring them up in front of everyone, they might hate that more than if you just give them a thank you note in the hallway or a pat on the back. Recognition for high performers has a high impact on employee engagement. So you need to celebrate victories, but also you need to celebrate the behaviors that help you build a culture of success. Consistently and frequently recognizing progress and achievements among teams is pretty simple with just basic gratitude by saying thank you to someone. We also need to consider employee input. I don't know if any of you have heard of the IKEA effect. It's a pretty interesting concept. It's the idea that the more work you put into something, the more you're going to love it. So managers and executives are trained to make decisions themselves to kind of hold the team up on their own shoulders. They may never consider soliciting input from their employees, but it's more likely that these employees have a better perspective on customer needs or organization needs. The top-down management culture can have serious ramifications for employee engagement because it makes people feel like their voice doesn't matter and that they're not going to be heard. So if we can prepare our team and mold them to be better as a whole versus the sum of their parts, we'll be able to keep a close eye on the game and listen carefully to each of our team members. Business leaders need to adopt an approach of coaching and listening as much as possible to their employees, because employee input is one of the most valuable but underused resources in a company, and it's the foundation of employee engagement. Again, your employees aren't going to buy in if it doesn't appeal to them, and if they give you input that you don't consider, they're probably going to feel like you're not going to consider anything else that's important to them. Finally, we need to address diverse and growing needs. And one of the biggest challenges when it comes to relationships is that we're all different. We all have different opinions and we all perceive the world in different ways. And so it's a stumbling block that we come across when we try to build relationships, because it's a lot easier to be friendly with someone who thinks the same way we do. We feel more comfortable when we feel like people get us and can see our point of view. And while it might be easier to build relationships when people think exactly like we do, life is actually more boring if we're all the same. So a great starting point is to accept and celebrate that we're all different and acknowledge that each employee will experience their workplace differently. Change has to be demonstrated first by our organization's culture champions, which includes leaders of HR, talent, and communications, who all have a personal investment in culture and engagement. Before employees feel comfortable joining in, the leadership has to buy in first.
Great, thank you, Abby. So we just inundated you with a lot of information. So we're going to quickly review what we went over to cracking the code for health equity, inclusion, engagement in the workplace. It starts with investing in that culture of equity, well-being, and safety. Leadership is so important. So equipping them with the right tools and how to commit to this change is key. And also understanding, like Abby just said, that leadership really needs to model the way so that employees buy in. Understanding reach should go beyond just your full-time employees, but that should be your part-time employees, seasonal and contract employees, and really solicit their feedback. Creating those positive workplace relationships is so key to breaking down the stigma, unconscious, and systematic biases that we have as human beings. And then finally, evaluate the progress and adjust as needed. So we just touched the tip of the iceberg today, and it's really up to you all to chip away at this huge iceberg. But it's really important to understand that if you start small, you can create something really big. Thank you.
So now we have some time for questions. So these are some questions that we came up for the audience, just in case there weren't any for us. But I'm going to go ahead and go to the slide where it has our contact information, just in case you'd like to reach out to us directly. And I'll pass it off to Kaylee, who will moderate the questions for us.
Yeah, so feel free to use the chat box that I mentioned before. It should be at the top or bottom, depending on how your screen looks, of your screen, and there's just a little chat box, and you are able to type right in any questions that you have. And as Abby was mentioning, their contact information is right here. It'll also be sent along with not only in the copy of the slides, but in the email that I will send out right after this. It'll have a link to both of their emails directly, so that if there was something that instead of asking on the chat box, you'd feel more comfortable talking directly with one of them, I'll provide that to you pretty quickly here. So I don't see any questions at the time, but please feel free to continue to type in while I'm talking through some of these other things. I just wanted to give a reminder that we do have some upcoming events. Next Thursday, August 16th, we're having our HealthLinks annual event celebrating Colorado's healthiest places to work. And we have a few workshops in the morning. I highlighted here our leadership lab. It's going to be before the event starts between 10 and 12. And you can register using the link here or in the email that I send. Or if you go to our website, you can also find the place to register for this leadership lab. And that is going to be led by Natalie Schwatka, who did our previous webinar on organizational culture. The next one I wanted to highlight is an in-person training. It is happening down in Pueblo, Colorado, but it's going to be a really great safety training for all marijuana cultivation workers. So I wanted to highlight that, and you can extend that to your network to see if there's anybody who may be interested in attending that. And our next webinar, we're going to have a short break on webinars. I know we've been doing bi-weekly, but to kind of accommodate for the event and other things that we have happening, we will not have another webinar in August, but we will pick right back up in September, and it's going to be on evaluation and how you can best evaluate your programs, policies, and work related to workplace health and safety. So just wanted to let all of you know, if you haven't become a recognized healthy business, to go ahead and visit our healthlinkcertified.org website, and you can go ahead and do that. Take the online assessment, or if you have any questions, feel free to contact David Shapiro, and his email is also listed here. And if you're a business in Colorado and you have 500 employees or less, and you're looking for just a little bit more in terms of employee culture and total worker health leadership training, I think the Swell Study would be a great option for you, and you should check it out. And lastly, for all of you who are passionate about workplace health and safety across the nation, I would highly encourage you to join our ambassador program. I am spearheading this initiative and would love to work with each one of you to spread the word about creating healthier and safer work environments, and just promoting the mission that becoming a certified business is the way to go, first step in the right direction, and we can spread that word all across. These are our platforms, so if you haven't followed us, follow us now, and we'll connect with you there. I didn't see any questions come through on the chat, but I will, again, in this presentation, it will give the contact information, and I will send that out here shortly. So thanks for joining us, everyone.
Thank you.
Thank
Bye.
you.